Welcome to another session of CareerBiome. Today I'm very excited. I have a special person here who is also a trailblazer in research, who is my supervisor, who is my mentor in academia, in research. And it's a pleasure to have you here, Gerald.
Nice being here also and being part of this discussion with you.
Yeah. So this is CareerBiome. As you mentioned, we bring you people who are doing work in research, in careers, in science. And Gerald has been a huge part of my journey as a researcher. And it's interesting because, we have moved together from my bachelor's to my master's and now to my PhD. Gerald is my supervisor. He's also my mentor who has walked the journey. I cannot talk about my career growth and journey without mentioning the name Gerald somewhere in the story. But before I get into the details of all of this we are going to discuss, I want to read for the viewer a bit of your profile. Of course, this is just scratch on the surface, but there is so much about Gerald, and I'll provide a link where you can read more about his work. So one thing, Gerald doesn't like to be called doctor.
Yeah, that's okay.
Okay, we can leave that, but I'm going to say Gerald is a visionary scientist advancing global health through genomics, bioinformatics and public health, and particularly across the low and middle income countries. That is where his work focuses mostly. His work blends cutting-edge genome sequencing with practical, high-impact tools for public health systems like the RMAP, HIV drugs pipeline. These are tools that are actually shaping how we respond to antimicrobial resistance, to HIV drug resistance across Africa and beyond. And I just want to say, beyond the data and research and the global impact that Gerald has, he's someone who sees people, who sees mentees, who sees his students, and he builds capacity. And I am privileged to be one of the people that he has under his watch or studentship as a PhD student.
And you have not disappointed.
I'm so glad that he says that even on screen. So let's get into this, Gerald. When it comes to, for example, the tools you've mentioned about RMAP and HIV drugs, this is at the core of implementation science.
Yeah.
The viewer might not, because you have a wide audience, how are these tools helping and what is at the center of their impact?
Okay.